BOA MHRA Guidelines 2017 Medicine and Healthcare Product Regulatory Agency Follow-up. The guideline states intervene before tissue and bone damage. Number 1, ASR or resurface hip annual follow-up with Oxford hip score and metal ion check. Mars ultrasound or MRI if score deteriorating or iron levels rising. Number 2, symptomatic metal on metal annual follow-up with Oxford hip score and metal ions if symptomatic, Mars MRI and ultrasound. Asymptomatic stemmed with head size less than 36. Follow up annually for 5 years, then every 2 years for 5 to 10 years, and then every 3 yearly. Bloods, cobalt and chromium ions in high level indicate surface wear, but increasing iron level should not be sole indicator for revision of implant. More than 7 parts per billion ppb, 7 parts per billion equates 120 nanomole per liter cobalt and 135 nanomole per liter chromium. Mars is metal artifact reducing sequence, cystic or mass lesion or fluid collection. 3 categories: cystic, mass or fluid collection. Metallosis, deposition and buildup of metal debris in soft tissue. LVAL. LVAL is synonymous with pseudotumor. Adverse or AMD, adverse reaction to local tissue reaction to metal debris. Adverse reaction to metal debris, AMD. Type 4 hypersensitivity, aseptic lymphocyte dominated vasculitis associated lesion. Metal ions slowly release from the bearing surfaces as a byproduct, where particles plus native proteins create haptens and activates inflammatory response. Granulomatous inflammatory response, mass causing extensive collateral damage. Local destruction response leads to pain, osteolysis and loosening. Systemic effect, query of DNA damage. Teratology, metal ion crosses the placenta. McKee and Farrar hip, introduced 951. Cemented Vitalium socket, stemmed base on Thomson, designed to be bipolar bearing, higher wear rate due to high contact loading.